Most people believe that when a surgeon recommends an operation, the surgeon has your best interest at heart. The hospital has the equipment. The team is ready. All you have to do is sign on the dotted line. I believed that too. For years, I believed that. Until I read a study published in the Journal of the American Medical Association that stopped me cold. Hospitals, the very institutions we trust with our lives, make up to 330% more profit when your surgery goes wrong, not when it goes right, when it goes wrong. And medical experts estimate that up to 40% of elective procedures performed every year are unnecessary. 40%. That is not a small margin of error. That is a systemic failure. My name is Dr. James Carter. I'm a cardiothoracic surgeon with over 2 decades in the operating room. And today, I'm going to tell you the exact phrases, the specific words that should make you stop everything, put down that consent form, and protect yourself before it's too late. Stay with me. Here's something most people never think about. Your body at 65 is not the same machine it was at 45. That sounds obvious, but the way medicine treats you often doesn't reflect that reality. Think of your cardiovascular system like the electrical wiring in a house. When the house is new, those wires handle surges, fluctuations, heavy loads, no problem. But after 40 or 50 years, the insulation starts to crack. The connections loosen. The system still works, but its margin for error, the amount of stress it can absorb before something sparks, gets narrower and narrower every year. Surgery is one of the biggest surges your body will ever face. General anesthesia alone forces your heart to work harder, your lungs to process chemicals they weren't designed for, your kidneys to filter medications at a rate that strains them. And your brain, this is the part that shocks most of my patients, your brain can become disoriented in ways that last weeks or even months after an operation. Doctors call it post-operative cognitive dysfunction. Most patients have never heard that term until they're living it. Now here's what that means in practical terms. A major study analyzing Medicare data found that almost 1 in 7 older adults die within a year of major surgery. Not during surgery, within a year. And patients over 90 were 6 times more likely to die after surgery than patients between 65 and 69. So when someone in a white coat is sitting across from you recommending an operation, the words they choose matter. They matter enormously. And there are 5 phrases, 5 specific things, that if you hear them, you need to stop, take a breath, and seriously reconsider what's happening. Let me walk you through each one. We need to get this scheduled right away. Now, I want to be very clear about something. There are genuine emergencies. A ruptured appendix, internal bleeding, a perforated bowel. Those situations don't wait. Nobody is suggesting you pause in a genuine emergency. But here's what I see far too often. A patient walks in with chronic back pain, a slow-growing mass, a narrowed artery that's been narrowing for years. The condition is not new. It did not appear overnight. And yet the surgeon says, we should get this on the calendar as soon as possible. Why? Because urgency bypasses thinking. Urgency shuts down the part of your brain that asks questions, weighs options, seeks a second opinion. And that is exactly why manufactured urgency is one of the most common pressure tactics in surgical practice. Here's what a good surgeon says instead. A good surgeon says, here's what I recommend. Here's why. And here's how much time you have to think about it. A good surgeon gives you space, time to consider, time to breathe. I had a colleague, a brilliant spine surgeon, who once said something I've never forgotten. He said, Kevin, sometimes the best operation is the one you don't do. I think about that a lot. What should you say back? Write this down. I'd like to understand all my options before we schedule anything. That single sentence changes the entire dynamic. It tells your surgeon that you are not a passive signature on a consent form. You are a participant in your own care. Have you ever felt rushed into a medical decision? I want to know. Write that in the comments. Now this one I need you to take very seriously, because this phrase does more damage than almost anything else a surgeon can say. This is your only option. When you hear those words, I need you to hear what's actually being said. Not, this is the best option. Not, this is what I recommend. This is your only option. As if every other possibility in modern medicine has been exhausted and the scalpel is all that's left. In over 20 years of surgery, I can count on one hand the number of situations where surgery was truly the only option. Medicine has changed enormously. Robotic procedures, catheter-based interventions, targeted therapies, supervised medication protocols combined with rehabilitation. Approaches that didn't exist 15 years ago are now available in most major hospitals. Let me give you a real example. Open heart surgery, coronary artery bypass grafting used to be the default for blocked coronary arteries in older adults. Today, we have something called TAVI, transcatheter aortic valve implantation, a catheter-based procedure that never requires stopping the heart or opening the chest. Less dramatic than surgery, but far kinder to a body that needs kindness, not a battle. And here is what genuinely frustrates me. Studies show that for elderly patients with degenerative spine disease, aggressive spinal fusion provides no better long-term pain relief than physical therapy and targeted injections. No better. But with a complication rate exceeding 40% in patients over 65. 40%. So when a surgeon tells you there's only one path forward, question it. What should you say? What happens if we don't operate? What does watchful waiting, medication, or targeted therapy look like for someone my age? That question opens a door that many patients never even knew existed. Here's one that surprises almost every patient I mention it to, because it sounds so reassuring. At your age, this is completely routine. Routine. That word is meant to calm you. And in many cases, the surgeon genuinely believes it. But here is what 2 decades of operating has taught me. Nothing is routine in a body that has lost its reserves. There's a medical term that most patients have never heard. Frailty. It doesn't mean weakness the way most people use that word. Frailty is a clinical measurement. It means your body's ability to absorb stress and recover from it has dropped below a critical threshold. Roughly 40% of people over 75 show signs of frailty. That number jumps to nearly 60% over 85. And here is the distinction that changes everything. It's not whether someone can survive the operation. It's whether they can survive the recovery. Those are 2 very different things. A surgery that is perfectly routine for a healthy 60-year-old can be life-threatening for a 78-year-old with kidney disease, mild diabetes, and reduced mobility. The same operation, completely different risk. And yet the word routine flattens all of that complexity into a single false reassurance. What should you say? Can you tell me what recovery realistically looks like for someone with my specific health conditions? Not the average patient, but me. My heart, my kidneys, my medications. The answer should be specific. If it's vague, that itself is information worth having. I want to pause here for a moment because this next one is something most patients would never think to question. I've done thousands of these. Trust me. Experience matters. I am not disputing that for a second. But experience alone is not safety. Not for you. Not for your specific body. Here's what I mean. A surgeon may have performed 1,000 knee replacements. But how many were on patients over 75 with 3 or more serious health conditions? How many were on patients with your specific cardiovascular profile? Those are different questions, and they have different answers. And here's something most people don't realize. A doctor may have done 1,000 procedures, but not one in the last 5 years. Skills change. Protocols evolve. What was standard practice a decade ago may be outdated today. So here's the question most people never ask. And I need you to write this down because it may be the most important question on this entire list. What is your personal complication rate for this procedure in patients over 70? Surgeons track this. They know their numbers. A confident, honest surgeon will tell you without hesitation. If they seem uncomfortable with the question, that discomfort is itself an answer. Has a doctor ever responded to your concerns by simply saying, "Trust me"? Tell me in the comments. And I've saved this one for last because in many ways, it's the most dangerous of all. You don't need a second opinion. Let me be direct. Any doctor who discourages you from seeking a second opinion is waving a flag so red it should stop you in your tracks. A good surgeon welcomes a second opinion, not because they doubt themselves, but because they understand that a patient who makes an informed decision, a decision confirmed by more than one perspective, is a patient who trusts their treatment, and that trust directly affects outcomes. Studies have shown that patients who lack confidence in their care have measurably worse recovery, even when the treatment itself is identical. Now, let me connect this to something bigger, something that most people have never been told. Remember that study I mentioned at the beginning? The one published in the Journal of the American Medical Association? It didn't just find that hospitals profit more from complications. It found that the entire system, the way it is structured right now, penalizes hospitals for reducing harm. The study author, a chief medical officer at one of the country's leading hospitals, said this directly. We found clear evidence that reducing harm and improving quality is perversely penalized in our current healthcare system. That is not a conspiracy theory. That is published research from one of the most respected medical journals on earth. The system is not always designed to protect you, which means you must protect yourself. And the simplest, most powerful way to do that is to get a second opinion every single time. What should you say? I appreciate your recommendation, but I'd like another perspective before making a decision this important. All right, we've covered 5 phrases. And I want to reframe this entire conversation right now, because information without action is just anxiety, and that is the last thing I want for you. This is not about distrusting your doctor. Surgery saves lives every single day. I have seen it. I have been part of it. I am proud of it. This is about being an informed patient. And an informed patient walks into every surgical consultation armed with 5 simple responses. 1. I'd like to understand all my options before we schedule anything. 2. What happens if we don't operate? 3. What does recovery look like for someone with my specific health profile? 4. What is your personal complication rate for this procedure in patients my age? And 5. I'd like to get a second opinion. 5 sentences. That's all it takes to shift from passenger to pilot in your own medical care. I want to tell you about a patient. I'll call her Margaret, 74 years old, retired school teacher, sharp, warm, the kind of person who remembered every student's name 30 years later. Margaret came to me after her surgeon recommended open-heart surgery for a partially blocked coronary artery. She told me something in that first meeting that I have never forgotten. She said, "Dr. Carter, my husband had surgery 3 years ago. He went into that hospital as the man I married. He came out, and he was never quite the same. The confusion, the fatigue, the look in his eyes. I can't describe it, but he was gone in some way I still don't understand." She wasn't afraid of dying on the table. She was afraid of surviving the surgery and losing herself. When I reviewed Margaret's full profile, her kidney function, her frailty score, her cognitive baseline, I sat with her for 45 minutes. Not 15, 45, and I told her the truth. Surgery was an option, but so was an aggressive medication protocol combined with cardiac rehabilitation and careful monitoring. The data for her specific profile showed comparable long-term outcomes between both approaches. She chose the non-surgical path. That was 3 years ago. Last month, she sent me a note. She volunteers at a literacy program twice a week. She walks 2 miles every morning. She enclosed a photograph of herself at her granddaughter's graduation, smiling like she'd been given a second chance at life. Because she had. Here is what I need you to understand. This is the single most important thing I will say today. A surgical recommendation is not a verdict. It is the beginning of a conversation. You are not a passive recipient of medical decisions. You are an active participant in your own care. The surgeon holds the scalpel, but you hold the choice. And that choice, made with full information and clear eyes, is the most powerful tool in medicine. More powerful than any operation I have ever performed. Let's bring it all together. 5 phrases that should stop you cold before any surgery. We need to get this scheduled right away. Manufactured urgency is not medical necessity. This is your only option. It almost never is. At your age, this is routine. Nothing is routine in a body that has lost its reserves. I've done thousands of these, trust me. Ask for their complication rate in patients your age. You don't need a second opinion. That is the biggest red flag of all. Which of these phrases have you heard from a doctor? I genuinely want to know. Tell me in the comments. I read every single one. And if this video helped you, or even made you think, please share it. There is someone in your life right now. A spouse, a sibling, a parent, someone over 60 who is sitting in a surgeon's office, or about to be, and they have never heard any of this. That one share might be the most important thing you do today. If you haven't subscribed yet, please do. Every week, I bring you honest, evidence-based information that I wish every one of my patients had access to long before they ended up on my operating table. Take care of yourselves. Stay curious. Keep advocating for your own health. You deserve a surgeon who answers every question, and a medical team that treats you as a partner, not a procedure. And one last thing. Everything I've shared today is general medical information based on published research and my own clinical experience. Every person's situation is unique. Before making any decision about surgery or treatment, please have a full, honest conversation with your own doctor or specialist. They know your history, they know your body, and that conversation, informed, direct, and unhurried, is exactly where good medicine begins.